The measles are supposed to be a disease of the past, yet we're hearing more and more about outbreaks in the United States. So we sat down with Dr. Scarlet Constant, who says the main reason is parents not vaccinating their children. Take a look. Measles are very preventable, so why do we hear about this? Well, I mean, I hear, I'm going, the measles?
Right.
Like, what century are we in? Right?
Right. I know, absolutely. And the reality is, it's a very simple answer. It's due to non-vaccinators.
So it's because someone does not get vaccinated and put others in harm's way?
Exactly. So basically, this specific area is very interesting because what they call it is a non-vaccinator pocket. This is actually an area in Washington where there are several families that refuse to vaccinate their children. And because of that, again, this is where the herd immunity, this is the opposite of herd immunity. Now that we have a few people that are vulnerable and able to contract the disease and spread it, this is how we have this massive outbreak.
And it's hard to handle that because if it's a neighbor or something, what do? You move? Right. You say, look, you're not vaccinating your children, I'm worried.
Right.
You know, it's a hard decision.
It is, and you send your kids to the same school, everybody goes to the same school, they're all together, and this is what happens.
My goodness, and hopefully those people will be okay because I know they're still watching them day by day.
Yes.
Now, one of the main ways measles is spread is by unvaccinated travelers bringing the infection back into the country. So take a look at this video from the Center for Disease Control and Prevention that explains why vaccinations are so imperative. All right, so we're going to talk more about the vaccine in just a minute, but first let's talk about measles. What exactly are they? I mean, it's just so ancient to me. Define it to me. Look at this.
Measles is a virus that causes viral-like symptoms, cough, cold, coryza, and then spreads to a rash. Unfortunately, it can spread very quickly. It lives on surfaces for up to 2 to 3 hours after exposure. Wow. Therefore, it's very contagious.
And it's not just a rash. Let's show you some of the dangerous complications that measles can cause. Ear infection, lung infection.
Yes, absolutely. Pneumonia. So ear infection that can lead to meningitis, lung infection, which can lead to pneumonia, complicated pneumonia, difficulty breathing due to inflammation of the upper airways and actually occlusion of the airway, diarrhea, and brain infection known as encephalopathy and death.
So obviously if measles surfaces, you got to go to the doctor immediately.
Of course, absolutely.
How is it treated, if I may ask?
Well, there's no known treatment for measles. It's actually a viral illness. There are some antivirals that have been shown to work, and vitamin A therapy right now is the only mainline therapy that's been shown to work. There's evidence supporting that it'll help keep symptoms at bay and bring you to a quicker recovery. A
couple more questions. How contagious is it, and how is it spread?
It's spread via respiratory droplets, saliva, mucus, and it's spread very rapidly.
Oh my goodness. All right, remember, if you have a question for Dr. Constant this hour, let's show you our toll-free number. Give us a call, 855-796-4475. So the name for the vaccination with measles, is that the MMR one?
That's right, yes.
Okay, and that one, but that one covers, you just said, measles, mumps, and rubella. So talk about the other two.
So the mumps, very old also disease, and that causes inflammation in the lymph nodes, the parotid glands, which are here by the neck, and also the lymph nodes in the inguinal area. Those were like big lumps and sometimes could even cause infertility in men if left untreated, in little boys. Rubella is basically the German measles, so these are all old viruses.
Now, why is, you just said it, old viruses, why can the measles spread a lot and we hear about it, there could be an outbreak, but not rubella and mumps?
Well, the measles are still, well, first of all, the measles still exist in other countries. That's the major one. It definitely still exists. And also because it spreads so easily. Like I said, they live on surfaces 2 to 3 hours after exposure. So that is just a really easy way. You can go to an airport an hour later and pick it up and keep spreading it to other people.
All right, and how long has that vaccination been around for the measles? Long time, right?
Oh, yes, since the
This is a Trivial Pursuit
I
question.
know. It's it was since the 1940s or so.
Okay, so it's been around a long time. Nope. All right, I do want to ask you, in terms of the measles, like, you know how they say if you get the flu shot, you may get the flu. If you get the measles vaccine, can you still get the illness after being vaccinated?
Usually not.
Okay.
No, usually not. You create enough immunity that you create the immunity that lasts a lifetime and is able to combat the virus, so you should not be able to get it.
So if there's an outbreak, hypothetical if, like there is in Washington, you know, what are you supposed to do to protect your child if you're faced with something like this?
Right.
Or if they're too young to receive the vaccination?
Well, if they're actually the MMR vaccine, if needed, you can give it as young as 6 months of age. The only caveat is that if you give it that young, then you'll have to give an extra booster dose. So they'll get 3 doses as opposed to the 2. What you want to do is protect your children from the people around that might have it. So we're talking about washing our hands, staying indoors, you know, covering, if they're going to school with children where there's an outbreak, you're probably going to want to make sure that they're not exposed to those children. I think something like this is different. It's more of a medical emergency, and so there are big procedures in place to retain them. But if it's something where we're down here and there isn't an outbreak and you just hear about one person, I mean, the reality is just the same way you protect your kids from the flu or any other virus.
And that's really a great point. In order to prevent the spread of any diseases, just make sure you and your children wash your hands all the time.